Hi, I'm Dr. Sudit Ranade, and I'm the Medical Officer of Health for Lambton Public Health and the County of Lambton.
So thank you for joining us this morning. Would you be willing to tell us from your perspective, what do healthy rural communities mean and why are they important?
Sure. I think healthy rural communities mean that people in those communities have access to all of the supports and enablers that they need to be healthy. And there are some ways in which that's exactly the same as a healthy urban community, and there are some ways in which it's different. I think we see a large focus on the scale of these communities in terms of their ability to move between them and around them in rural communities, and also the way in which they're built can enable or disable people from having access to the same kinds of services that a person in an urban area would have access to. I think those are two key features, which is why when you get rural communities together and they say, what do you need? They say that we need things like transportation. We need things like technology to help bridge gaps in service. But it's not just service. I think it's also about creating a community in which people are engaged in the development of their own health, and that has some unique challenges in rural environments.
It's interesting. This morning we've heard people talk about age-friendly communities.
Yep.
We've heard folks talk about the healthy toolkit that you folks have developed here in Lambton. Anything more you'd like to say about either of those topics?
I think, public health has been moving towards greater emphasis on the built environment for so many reasons, but I think it's one of the places where we can have the biggest impact if we do it right. It really bridges public health and healthy public policy in a way that enables the health of the wider population, that includes people who are vulnerable, but also the people who have a reasonable baseline health, but whose health could be improved. I think that that work takes many forms, and it's still developing and growing and changing, but certainly public health has an active and growing interest in this field.
What I think is also fascinating this morning in many ways, it's about bringing planners and public health staff together. And how do you see those two working together, and why do you think that's important?
I think every time we have a chance to bridge between worlds, we have a way of doing things better than we ever thought before. So if you think about before, where it was like planners do planning, public health does public health, that's not the way anyone can afford to operate anymore. I would even expand the circle and say that we need to include not just planners in public health, but even designers. I think there are ways that planners are taught things differently from designers. Yeah. And there is a way to build environments that are both aesthetically pleasing and well planned, and that offer a complement of ways in which people can be healthy. I think there's a way to do that all together, but requires putting different people with different perspectives at the right table, and then enabling them to push forward ideas that might be controversial, that might have long-term consequences, but people can't see the immediate benefit in the short term. And I think we need the courage to do that.
Yeah. One final question. I've said that already, but one final question. We'll have, I anticipate we'll have students from Masters in Planning, and we'll have students from doing a Masters in Public Health. What advice would you have to those two aspiring groups of young professionals?
Oh, yeah, well, I would say pay attention to your training. Your training will give you a lot of tools, but don't pretend or assume that your training is everything. And so really, just like you're reaching out now to bridge between the worlds of public health and planning, think about bridging other worlds too. Think about bridging to creative worlds, creative spaces. Think about bridging to philosophical worlds, because these are the places where you're really going to start having the kinds of connections that can push us all forward.
That's fantastic. Thank you so much.
Yeah, thank you.
Thank you.